Can you speak a little bit, Megan, on some of the other complications with the purging?
Yeah. So other complications, like the one that scares me the most is the heart stuff. So you can have changes in like the electrical activity of your heart. Can prolong the QTC interval as a part of it, and that places what's what places you at a high risk for arrhythmias. And the QTC can get prolonged due to imbalances of your electrolytes. So magnesium and potassium are big ones. If those are low, which happens a lot with vomiting or with laxative use, that can really lead to it being scary out there. Other things that can happen with purging, one that I didn't realize so much until I was actually treating them, was all the like damage that can happen to like your oral pharyngeal. So like all the dental issues that arise.
Mm-hmm.
I've seen like for patients with like 7 cavities, had to get root canals, they had to get all this stuff done. And they had like a lack of insight to it, and even I had a lack of insight to it because you wouldn't think about like teeth, but
And why do the teeth get damaged?
so when you're purging or when you're throwing up when the vomit comes up into your mouth, it's highly acidic. The acid erodes the enamel in your teeth over and over again. And when patients are purging multiple times a day, that's just multiple times a day that you're just eroding the teeth that aren't built for that.
Mm-hmm.
And so it really can do some damage over time and pretty quickly, honestly.
Wow. And I bet, yeah, they're not thinking about that, and it can damage the lining of the esophagus as well. And that's not on their mind. So
Mm-mm.
good to be aware of.
Yeah, it can have you can develop GERD earlier, and the longer, so gastroesophageal reflux disease, and the longer that you have GERDs for, it increases your chance for Barrett's esophagus, which is a precancerous like disease. And so it can have long-term effects that people normally wouldn't think about.